If your blood pressure readings keep changing, if one day it's perfect and the next day it's dangerously high, you might not have a blood pressure problem. You might have a measurement problem. And for seniors, this matters more than you think, because one wrong reading can lead to unnecessary medication changes, anxiety, or worse, ignoring a real issue. I'm Dr. Monica Altman, and on this channel, we focus on practical, evidence-based strategies to protect your heart as you age. Today, I'm going to walk you through 5 very common mistakes people make when measuring blood pressure at home. Mistakes I see every single week in clinic. Let's start with the one I see most often. Mistake number 1, you're not resting long enough before measuring. Blood pressure is extremely sensitive to movement, stress, and conversation. If you just walked up the stairs, if you were talking on the phone, if you rushed to sit down and immediately put the cuff on, your reading will be artificially high. The American Heart Association recommends sitting quietly for at least 5 full minutes before checking your blood pressure. Feet flat on the floor, back supported, no talking, no phone, no TV. Even small movement can raise your systolic number by 10 to 20 points. That alone can make a normal reading look concerning. Now, mistake number 2, your arm is not at heart level. This is critical, especially for older adults. If your arm is hanging down by your side, your reading may appear falsely elevated. If it's raised too high, it may appear lower than it truly is. Your arm should be supported on a table, with the middle of the cuff positioned at the same height as your heart. A simple pillow under the arm can make a significant difference. It sounds small, but I've seen positioning alone change readings by 15 points. Mistake number 3, the cuff size is wrong. This is extremely common. If the cuff is too small, it will squeeze harder and artificially raise your blood pressure reading. If it's too large, it can underestimate the pressure. As we age, arm size can change due to muscle loss or weight gain. The cuff bladder should cover about 80% of the circumference of your upper arm. Many home machines come with only one standard cuff, and for many seniors, it's not the right size. If your readings are inconsistent, check the cuff size first. Now, mistake number 4, you're measuring at the wrong time. Blood pressure naturally fluctuates throughout the day. It's usually highest in the morning. It rises with stress. It increases after caffeine. It rises after meals. It increases with pain. If you check it randomly, sometimes morning, sometimes afternoon, sometimes right after coffee, you won't get a consistent picture. For most seniors, I recommend measuring in the morning before medications and in the evening before dinner. Avoid caffeine, exercise, and smoking for at least 30 minutes beforehand. Consistency is more important than frequency. Now, mistake number 5, you're reacting to a single reading. This one creates unnecessary fear. Blood pressure is not meant to be judged from one number. Even in healthy adults, readings can vary by 10 to 15 points from one measurement to the next. If you see a high reading, don't panic. Wait 1 to 2 minutes, sit quietly, measure again, then average the 2 numbers. What matters is the trend over time, not one isolated spike. Now let me tell you something very important. As we age, our arteries naturally become stiffer. This can increase systolic pressure, while diastolic pressure may stay the same or even decrease. That means numbers may look different than they did in your 40s or 50s. For many seniors, the goal blood pressure is individualized. It depends on overall health, frailty, fall risk, kidney function, and cardiovascular history. Over-treating blood pressure in older adults can increase dizziness, falls, and injury risk. Undertreating can increase heart attack and stroke risk. That's why accurate measurement at home is essential. When your home readings are done properly, they are often more reliable than a single clinic measurement. And one more thing I want to mention, white coat hypertension is real. Many seniors have elevated readings in a medical office due to anxiety, but their home readings are completely normal. The opposite can also happen, where office readings look fine, but home readings are elevated. This is called masked hypertension. Without proper technique, we can't identify either scenario correctly. So here's what I recommend. Pick a consistent time. Sit quietly for 5 minutes, back supported, feet flat, arms supported at heart level. Correct cuff size. Take 2 readings. Track the trend over a week. Bring those numbers to your physician. That gives us meaningful data to work with, not random spikes, not guesswork, real patterns. If this video is helpful so far, take a moment to like it. That helps more seniors find reliable, evidence-based information. And if you're committed to protecting your heart as you age, make sure you subscribe. Every week, we break down complex medical topics into practical steps you can actually use. Here's the bottom line. High blood pressure is one of the strongest risk factors for heart attack and stroke in seniors. But treating numbers without measuring them correctly can lead to the wrong decisions. Sometimes the issue isn't your blood pressure, it's how you're checking it. Small corrections can completely change your readings. Accuracy creates clarity. Clarity creates better decisions. Better decisions protect your heart. I'm Dr. Monica Altman. In our next video, I'll explain what your blood pressure numbers actually mean after age 60 and when you should truly be concerned. Stay consistent, stay informed, and take good care of your heart.